Hello, my name is Dr. Genevieve Hale. I'm an assistant professor at Nova Southeastern University and a clinical pharmacist at MMR Healthcare. My specialty is in cardiovascular medicine, and today I'm going to talk to you about statin medications. Now, you've probably heard about statin medications as those are the drugs that lower cholesterol, which is correct. They are definitely known for lowering cholesterol, and they are the best out there for doing so. There's different statins out there on the market. We have atorvastatin, also known as Lipitor. We have Crestor, also known as rosuvastatin. We have simvastatin, also known as Zocor. And then we have a lot of other ones, fluvastatin, lovastatin, pravastatin, pitavastatin. So there's a lot of statins. I see you probably figured out the trend. They all end in statins on the market. Now, why is lowering cholesterol important in the body? So what happens is if you have too much cholesterol in the body, this unfortunately can lead to serious consequences such as heart attacks or strokes that can occur. And how does that happen? I'm going to draw a very simple picture to help describe this. So let's pretend that this is a blood vessel in the body. And so blood vessels, they carry in the blood oxygen. So this blood vessel is allowing oxygen to get to our tissues, muscles, organs in order for us to function and live. What happens though if we have too much cholesterol in the body is it loves to stick to the walls of blood vessels. So what would that look like? It would look something like this. So it's sticking to the walls. And over time, if the cholesterol continues to build up, guess what else will build up? The cholesterol in the blood vessels. To the point where the blood vessel will get so narrow that the blood flowing with oxygen can no longer get through the blood vessel. The other thing that can happen is cholesterol unfortunately helps with the production of plaque. And if there's too much plaque in the body, and plaque forms this thing called a fibrous cap around all this cholesterol. And if that cap breaks, that leads to clots. So either a lack of oxygen because the blood can't flow or clots occurring will lead to either a heart attack of the blood vessels in the heart or a stroke, the blood vessels in the brain. And as most of us probably know, these are leading causes of death in the United States and worldwide as well. Now, how does cholesterol get produced in the body? There's two ways. One is through your diet. Fatty foods, animal-based products, these increase cholesterol in the body. Now, I'm not saying you can't eat beef, you can't have liver if you like liver. You can, in moderation. Fast foods though, fatty foods, cakes, cookies, unfortunately they're great. We love how they taste, but they increase cholesterol in the body. The other way is through your liver. Naturally, your body creates cholesterol in the liver because cholesterol isn't all bad. We need some cholesterol to help with things like hormone synthesis, so the functioning of hormones in our body, vitamin D production, as well as the creation of our cell membranes. The membranes are what actually hold the structure of our cells together. So it's not 100% bad, but we do need to balance the amount of cholesterol that's in the body. And how do we help with this balance? Things like the statin medications actually work in the liver. Remember where I said the cholesterol is produced, and stops the production. Not completely, by a certain percentage, depending on which statin we're talking about. Usually it's anywhere from 20% over 50%. Again, it depends on the dose and the statin we're talking about. And some people are at higher risk of these heart attack, stroke, cholesterol production happening. These are people such as those who have already had a heart attack or stroke, those with diabetes, those with something called peripheral vascular disease, or in general, those with other cardiovascular conditions. If you talk to your healthcare provider, pharmacist, physician, nurse, we can easily assess what your risk is of these heart attacks or strokes, and we may say that you need to be put on a statin medication. We're also going to look at different lab tests, such as something called an LDL, or low density protein, lipoprotein, HDL, high density lipoprotein, and these are the good and bad cholesterols in the body. LDL is also known as the bad cholesterol. You can remember it as L, the lousy cholesterol. HDL is the good cholesterol. H, healthy, is an easy way to remember it. We want as much HDL as we can get and as less LDL as we can get. And those numbers will vary based on your risk. Now, with all that said, you're probably thinking, well, that's great that these statins help reduce my risk of heart attack or stroke by reducing my cholesterol, but what about side effects? And yes, there are side effects that can occur like any other medication, muscle pain being the one most people worry about. Now, I'm here to assure you that the muscle pain occurs in about 1 out of 500 people, so your risk of the muscle pain is pretty low. Also, if you've had a family member who has developed muscle pain due to a statin, it doesn't mean you will. Usually there's not a genetic component involved. If you are still worried though, if you're on a statin and you start to get muscle pain, keep in mind that muscle pain can be due to a lot of other things. It could be due to, well, simply overexerting yourself. Could be because you're dehydrated. Maybe you need more potassium in your diet. And the list really goes on. Before you stop taking your statin medication, please, please, please call whoever your healthcare provider is that works with you on your statin medication. That way we can assess what the muscle pain is due to. And if it is because of the statin, the beautiful thing is that there are so many of them, and usually it's because of the particular one you're taking. And so we can easily switch you to a statin that has a less risk of muscle pain and still protect you against the heart attacks and strokes from occurring. The other thing that people seem to worry about the most is statins causing memory loss or leading to dementia, which I'm here to tell you the data out there regarding this suggests that there is not a correlation, association, or a reason to believe that statins lead to this. So I hope that helps relieve your concerns you might have about the side effects. Again, though, if you have more concerns or questions, please call your healthcare provider to help you do this. The last thing I want to say is if you're prescribed a statin medication, please take it every day as prescribed, or as prescribed rather. If you don't take your statin medication, it's not going to work. So if you need help remembering how to take it, please call your pharmacist, physician, nurse, again, whoever it is. We are well equipped to help give you strategies to remember to take your statin medications. So with that, I want to thank you so much for your time and attention, and I hope you have a wonderful day.